the first one, what is an aponeurosis? What's the difference between a tendon and an aponeurosis? You said it, it's a sheath, right? So a tendon's more kind of like a cord-like structure. Both, though, will be made of dense, regular connective tissue. And so what function does the aponeurosis have in the lower part of the abdomen? Very good. Because we're bipedal organisms, all our organs, the weight of them hangs down at the bottom of our pelvis, and they're pressing out, trying to herniate. Thus, if you remember, when we have the aponeuroses, there's a picture in your book where it talks about bacon and Canadian bacon, where most of it under your belly, what happens to the under your belly button, what happens to the aponeuroses? They all go towards the front, to the front or the back? To the front, in order to reinforce that wall and prevent herniation, right? So that's that one. The cecum is part of which portion of the gut tube? The midgut. So real quick, one more time. Somebody tell me our acronym for remembering the portions of the gut tube. Ed and JT are doctors. And thus we have Ed is the foregut. Sorry for those that were at SI yesterday, but we're going to do it again. And the foregut goes from what to what? What's E and D stand for? Esophagus. To the duodenum. So what else would it include? So it's going to have the stomach, and then, of course, those things that branch off the duodenum during embryology, or during embryologic development, which are the pancreas, the liver, and the gallbladder. So that is the foregut. Who innervates the foregut? Innervates. The vagus nerve. And who vascularizes this portion of the gut tube? The celiac trunk or celiac artery. Okay, and then JT, what part of the gut is JT referring to? The midgut. And as you guys are saying, it's jejunum to what? To the transverse colon. So that's going to be jejunum, ileum, sacrum, appendix, ascending colon, transverse colon. And this one is important because what goes on in the midgut? The majority of digestion. Your pancreas is going to spit out all your digestive enzymes into the duodenum so that the ileum and the jejunum can suck it all up. Who is going to innervate the midgut? Vagus nerve as well. And who vascularizes this region of the gut tube? Superior mesenteric artery. Vessels. And then finally, doctors refers to which portion of the gut? Hindgut. That's going to be, what's the D and the R stand for? Descending colon to the rectum. Who is going to innervate this portion? Parasympathetic splanchnic nerves from what spinal levers? Spinal levels? Very good. S finally, who vascularizes this region? Inferior mesenteric. Another useful mnemonic is here I have the abdominal aorta. So the portion of the aorta, this is the diaphragm, and down here is where it splits into your common iliac arteries. And we know that there are a bunch of branches that come off the abdominal aorta. And what we remember for this is, can Superman really go invisible? We clearly know he cannot. But what that says is, first, what's the first vessel that's going to kind of be coming off that splits into a lot of things? Celiac trunk. And then what's going to be coming off for S? Superior mesenteric artery. What's going to be coming off to the sides that represents R? The renal arteries. And then G is the unisex word for those arteries going to the places where you make gametes. They're called the gonadal. But if it's a male, we'll call them testicular, and female ovarian. And then finally, the I represents which branch? Inferior mesenteric. Do you guys like it when I teach you mnemonics, or would you rather not know?
Yes.
Okay. Any questions about that mnemonic? Again, that is used to remember what are the branches coming off the abdominal aorta. Can Superman really go invisible? Back to the questions. Okay, when blank contracts, it flexes the vertebral column and twists the abdomen towards the opposite side. What muscle are we talking about? The external obliques. We remember that when we flex those external obliques, that's if I'm flexing my right external oblique, it's going to rotate me, bringing my right ribs towards my left pelvis, the left side of my pelvis. Does that make sense? Whereas if I flex my right internal oblique muscles, what's going to happen? That's going to twist me towards the same side. That makes sense? If you kind of make the fibers and then squeeze your hand, it makes sense what's going to happen, if that helps. It'd look funny if you did that in a test. Okay. Blank is formed by the ventral fusion of the aponeuroses of the lateral abdominal wall muscles. So again, we remember those aponeuroses are those tendinous sheaths that come off the obliques and the transversus abdominis. And what are they going to fuse right there in the middle? The linea alba, that white line. And that's where they all connect. And it's almost like a bone. It's not a bone, but it's a thing that's stationary so that when you flex those muscles, you get movement. Why is the rectus abdominis split by tendinous intersections? So we know how many muscle bodies are there in our rectus abdominis. If you work out really hard, you get a 10-pack. So why is that? This comes down to an important chapter at the beginning of what we'll be test on next. It's an embryo story. And why exactly? Because originally we're derived from, what are those little squares at the back of each embryo? Somites. So it's all those somites that migrate, and some of the time, depending on what tissue it migrates through, it will stay sectioned into different portions, as we see in the rectus abdominis. abdominis. If it migrates through different types of tissues, it becomes one muscle belly. And that's another reason why when you look at tigers and zebras and they're striped, well, it's just every other somite has a different pigment. And thus, that's how those animals look that way. The inferior epigastric vessels come off what main vessel? External what? The external iliac artery or vein. So again, those inferior epigastrics are those ones that's going to come off right before those external iliac vessels pierce to go out to become the femoral vessels going down into your leg. Right before they do that, they shoot vessels up onto your rectus abdominis and ventral body wall. And those are our inferior epigastrics that come up and form collateral circuits with the superior epigastrics. Yeah?
I have to ask, do the inferior epigastrics, aren't they collateral with the lumbar?
They
vessels?
could be.
Okay. 'Cause
So essentially in the abdomen, you're going to get collateral circuits with the lumbar arteries coming from the back off the abdominal aorta, the superior epigastric arteries coming down from what is it called in the thorax? The internal thoracic arteries. They pierce the diaphragm, become the superior epigastric arteries, and also the inferior epigastric arteries coming up from your external. I've said too many things. What's those? Iliac arteries. Good question. Any other questions with that stuff? We have some traces coming up for you. Okay. 7, blank are a continuation of the azygous and hemiazygous veins as they pierce the diaphragm. So the azygous, is that on the right or the left side? The azygous is on the right side. If you're looking at me, it's on my left, right? But it's on your right side. And on the left side, we have the hemiazygous. Why do we have those vessels again in the thorax? Drain the back, because are the caval veins, the superior vena cava and inferior vena cava, in the thorax, are they back against the wall? No, they have to come out and drain into the right atrium, so they come ventrally. Does that make sense? So we have that azygous system, and when that, so just to draw it so I'm not just talking, we have the azygous that comes up the right side of the thorax and drains into the superior vena cava, and off of it we have the accessory hemiazygous and the hemiazygous. And here's my diaphragm, and so what are they called as the hemiazygous and the azygous go through the diaphragm into the abdomen? Very good, the ascending lumbar veins. However, in your abdomen, the inferior vena cava is back against the wall. So you essentially have lumbar veins, again, that could either go into the inferior vena cava and up to the right atrium, or they can drain into the ascending lumbar vein and head towards the azygous or hemiazygous and go into the superior vena cava to the right atrium. So those are things to remember. Questions with that? Yeah?
Is there any older follow-up or one relation to the ascending lumbar vein or the inferior vena cava?
That is arbitrary. You can choose whatever you're comfortable with. However, oftentimes he may give you there's a block in the inferior vena cava, which would kill you anyways, but for the sake of the question, and then you have to use the ascending lumbar veins. Does that make sense? So it's like if you're draining blood from the posterior wall of the abdomen, but the inferior vena cava is blocked, bring it back to the heart. So you try and do that.
And the inferior vena cava is on the posterior wall below the diaphragm?
Correct. What happens, the inferior vena cava is back against your vertebral column, and then right when it gets near the diaphragm, there's a nice hiatus, a hole in the diaphragm that's kind of in the center of your body, and it comes off the wall to go up through that hole.
Okay, so above that goes into the azygous or hemiazygous?
Correct. So essentially above the diaphragm, if you're on the posterior wall, you cannot go into the inferior vena cava, right? Because at that point, above the diaphragm. It's not backed by the wall, thus you must use the azygous and hemiazygous system. Good questions. Other questions with these? Yeah.
So you were saying the answer that the axis and the hemiazygous are continuations of what?
So the azygous and hemiazygous are continuations of the ascending lumbar veins. They're the exact same tube. It's just on one side of the diaphragm, on the lower side of the diaphragm, we call them the ascending lumbar veins. And when you go superior to the diaphragm, they're the azygous on the right and the hemiazygous on the left. Yeah?
Would that not considered a lateral flow, just the same vein?
It's just the same tube, yeah. It's not the collateral flow is when you have arteries coming at each other. So you're going to have two flows concerting on the same point. Does that make sense? For instance,
That's only on arteries, actually, right?
pretty much, yeah, it's on arteries. Whereas this, all the blood flow is in one direction going up. Whereas a collateral circuit is where you have them hit each other. Other questions? Okay. The last one, so this one's kind of something specific that he said in lecture. What innervates the external oblique muscle? So obviously, some of the external oblique muscle does come up on your ribs, and Justine, you were kind of getting to that. So what's going to innervate it if it's up by my ribs? The intercostal nerves. However, what do we call all the nerves below the ribs? He just gave us one word. No. There is a subcostal nerve, but for this class, we just remember two words. You said it. Ventral ramus. If it's not the intercostals, just remember it's the ventral ramus. Is that okay with everybody? There was that, I mean, you go and there's a subcostal nerve, there's an iliohypogastric nerve, there's an inguinal nerve, genitofemoral nerve. You don't have to memorize all those. All it is ventral ramus. Yeah, Leslie.
So it's ventral ramus under the diaphragm, like below.
Not under the diaphragm. The ventral ramus is under the rib cage.
Sorry.
So it's easy to remember between the ribs, we call them intercostals. Once you're below the rib area, we call them, just for your sake, ventral rami.